Welcome everyone to our weekly COVID-19 Q&A with Toronto's Associate Medical Officer of Health. This is our last one for this year. So a very big thank you again to Dr. Vinita Dubey for joining me for this one last Q&A this year.
Yeah, absolutely. Yeah, the year's gone quickly, hasn't it?
It's gone really quickly. I can't believe we're already at the end of these sessions, but we will be back next year. For today, we're going to get started. If you don't know how this works or you've never tuned in before, we've been collecting questions over the past week for the doctor, and we're going to present them to her today. She's never seen them before. It's all off the cuff. And if you haven't had a chance to submit your questions, you can still do so in the live chat in this broadcast, and we'll try to get to as many live questions as we can as well in this short 30-minute period that we have with the doctor. For now, we're going to get started with a cache of questions that we've been collecting, and then some aggregate questions that we've seen just over the articles that we've been posting and the things we've heard from viewers. For now, we'll get started with some vaccine questions first, moving on to Omicron questions, and then whatever comes in live, we'll take as it comes. Doctor, are you ready to go?
Yeah, let's go.
Excellent. Let's get started. We'll start with Phil's question. Phil asks, which jab has the short lifespan and hence the need for a third dose? Is it an industry-wide issue with all of the vaccines? And does that mean that the third jab has the same usefulness expectancy?
Okay, so a good question. We certainly know that if you've had 2 doses of a viral vector vaccine, like 2 doses of AstraZeneca, then your immunity certainly is less compared to 2 doses of messenger RNA. And so that third dose would be recommended. What we are finding is with, in light of this new variant, with the Omicron variant, that having those very high antibody levels are important, and that's certainly one of the reasons for the booster dose recommendation, because there's so much COVID spreading. You need your protection to be top notch, and so that's why even for the messenger RNA vaccines, the booster dose is recommended 6 months after the second dose. The reason for that 6 months is because it will allow them that third dose to give you that stronger immune response.
Okay. But then, doctor, when it comes to the other brands, we know about AstraZeneca waning sort of sooner. With the mRNA brands, is that the case as well?
Yes. So, the Moderna and the Pfizer have both been approved for booster doses because it was based on studies of antibody response. But we certainly are finding with this new variant in particular that people who are fully vaccinated can get it. Now, again, what we know with the vaccines, though, is that less likely to be hospitalized. And that certainly is part of the goal for getting the booster doses.
Right. Okay. Let's move on to Linda's question. Linda asks, I understand that more of the cases are now in children. However, for the adults, which vaccine did the breakthrough cases get? Who is tracking that? And what are the numbers, please? So basically, if you were vaccinated by Pfizer or Moderna, are you more likely to get a breakthrough case?
Yeah, so that information is actually being tracked by some of our science agencies. ICES is one, for example, that is tracking that. And really what it has shown, not just in Ontario, but also in Quebec and BC, that those 2 doses of AstraZeneca, have more waning. Really, not so much the brand of Pfizer versus Moderna, but about how long has it been since the last dose, and as well the age of the person is probably more of an indication of people who are getting that breakthrough infection.
Okay. So it's not about the brand of the vaccine so much as it is about the various other factors that lead to catching COVID in the first place.
That's right. Yeah.
Okay. And then let's move on to Cammie's question. I apologize for the frozen video. We're having a little bit of technical issues, but I think the doctor can still hear us, so we'll keep going. Cammie asks, my daughter is age 33. She received Pfizer for her first shot, then Moderna for her second, as there was shortage of Pfizer at the time. So for her third dose, then, what is the recommendation? Is it same as the first dose, same as the second dose, or does it even matter as long as it's just an mRNA vaccine?
Yeah, so the main answer is it doesn't really matter. you can get any vaccine as long as it is a messenger RNA vaccine. But if there's a choice at the clinic, then to get the second to match it with what you had for your second dose.
Second dose. Okay, so I had Moderna for my second dose, so I should get Moderna for my third dose, if possible.
If possible, but if they only have Pfizer, then get the Pfizer.
Then get Pfizer. Okay. All righty. Let's move on to our next question here. Oh, there's a part 2 to Cammie's question. Is there a 2-week waiting period after receiving the third dose before the booster can take full effect, like it was for the other 2 shots?
Yeah, in general, after you get your vaccine, it takes about 2 weeks for that stronger immune response to kick in.
Okay, and then we've got a question coming in live from our website here. George asks, for my kids under 5 years old who are ineligible for the vaccine, how can we keep them safe? If they get COVID, could it be very severe?
Good question. So we actually know how to keep children safe. Actually, if you remember back to last March, we kept our children home. Not a lot of children got COVID because they weren't actually out and about. So there's no question that we know how to prevent the spread, even of this new variant. It's by keeping a physical distance, by wearing a mask, by staying away from people who have symptoms, for example. Mm-hmm. We're not 100% certain on this new variant and its effects on children. There may be some early indications that it may be slightly more severe in children. And so, but what we do know is that it's spread a lot more easily. So I think preventing the spread, preventing getting COVID, not having them interact with other unvaccinated children, for example, if they are interacting, have it outdoors, wearing masks. That I think is something that I would certainly recommend. Okay.
And let's move on to another live question coming in from our website here. Scott asks, I received my third dose, a full dose of Moderna back in September because of an autoimmune condition. Would I be less protected than someone who is receiving their third dose now? That is, the longer the time passes, the less effective it becomes.
So, well, certainly as time goes on, your immunity tends to wane, but you have had your third dose. So it's really hard to compare you to someone else without kind of being in a head-to-head trial. And it hasn't been 6 months since your last dose. We know that giving the booster dose 6 months later helps to get that strong immune response. And so right now there are no guidelines for even someone in your situation to get another dose at a shorter interval, because if you were to do that, it might not give you the best response that you would be looking for.
Right. So, but at this point, is this person then less protected than someone who's going to get their third shot, at the 6-month interval or later?
It's really hard to know that, but I think there's no question that because you were eligible for your third dose because you were immunocompromised, you have to take extra precautions. Like because of that, regardless of when you got your last vaccine dose, and it's really, I can't directly compare you to say I can say the person who's not immunocompromised probably is more protected because they don't have a weakened immune system, more so. And so I think take all precautions yourself to help prevent getting the virus.
Right. Okay, let's move on to Kazim's question. Kazim asks, why can't we just vaccinate only vulnerable kids and not all of the kids, as we don't have enough data on the impact on kids? Why do we say that all kids are high risk?
Well, all kids are at risk of getting COVID. I mean, we've seen that since the end of the summer. Kids have the highest rates of COVID in our city, and that's because they're unvaccinated. So by keeping kids unvaccinated, they will get COVID and they will spread it to others. Now, we have a lot more information about the vaccine in children. I mean, the U.S. has given more than 5 million doses. We have given in our own cities tens of thousands of doses, even across the province. So we have a lot more experience to really say this vaccine is safe. The side effects of the vaccine are very minimal. And we know that if more children get COVID, more children will get very sick from COVID. We know that children can get very sick from COVID. And so that is really why it's important that we vaccinate all children who are eligible.
Right, right. Okay, next question. Any updates on Toronto's plan for the Johnson & Johnson vaccine?
So the Johnson & Johnson vaccine was made available, a very small supply for all of Ontario. We do have a form on our website for you to take to your doctor. It's only eligible for people who were contraindicated from taking a messenger RNA vaccine. So either because of an allergy or maybe they had a bad reaction to their first dose of, say, a messenger RNA vaccine, they would be eligible for the Johnson & Johnson vaccine. They have to get a form signed by their physician, though.
So the form is available on the city's website. I print it out, I take it to my doctor, get them to sign it. And then what happens after that? I take the form to a mass vax clinic or make an appointment with in the regular way?
No, you would have to submit it back because there's not going to be these vaccines available at every clinic. So the goal is to try and get everyone on the same day so that we don't waste doses, for example. It will also have to be reviewed to make sure that that person is eligible as well. So all of the information is on the website, the Toronto Public Health website for anyone who lives in Toronto. If you live in another health unit, you'll have to go to that health unit's website.
Right, okay, okay. And then let's move on to our next question. Is it still safe to have daycares open, given that the little ones can't be vaccinated?
So what we know, even with this variant, again, is those measures that we have in place. I mean, we've been through this so many times. We know that they work. Again, cohorting, keeping that physical distance, wearing that mask. Even though we have the Omicron variant here, and we certainly see that it is spreading, we're seeing that it's not necessarily spreading like wildfire in schools or daycare centers, right? They have measures in place. Those children that can wear a mask, keeping smaller cohorts as well. Where we're seeing it really spread is in a lot of those social environments, eating and drinking without masks on, playing sports without masks on, close contact. That's really where we're seeing a lot of the spread right now.
Mm-hmm. Okay, so let's move on then to some Omicron questions. If we have the supply and Omicron is spreading, why aren't we releasing third dose boosters for everybody already? Why do we have to wait till January?
So I think, we want to make sure that those who are at highest risk get the vaccine first. And we know by age, you are at higher risk. And 50 is not that old. And so we know that 50-year-olds have a higher risk of ending up in hospital than a 20-year-old, for example. So that's why 50-year-olds should get their vaccine now. There will be more announcements coming out, though, on when other adults will be eligible and able to get the vaccine.
Okay, and then we have a live question coming in from YouTube, but this is also one of our submitted questions. Is Omicron a milder variant, like say similar to the flu? And if so, isn't that what we want? My understanding is that that's the type of mutation we want to move towards.
Okay, so good question. So I know that some people look to South Africa and they say, oh, it was mild there in South Africa. It's not directly comparable to what happened in South Africa. We know that South Africa has a much younger population. We also know that South Africa has had COVID run through it. And so many of the people in South Africa, if they're not vaccinated, got COVID. And that may also explain some of what they're seeing there. Now, remember, hospitalizations and ICU admissions are late. It can take 1 to 2 weeks of having an infection before you get very sick from it. And they are starting to see some impact even on the severe illness. So right now, what it looks like is it may be as severe as the Delta variant. Even if it is slightly less severe than Delta, because it is so much more transmissible, which means it spreads so much easier, and because our vaccines don't have as good protection as they did with the Delta, if we have that many more people getting the virus, we will definitely have that many more people ending up getting very sick. So It's not a mild illness for everyone. That is for sure. What is seeming to show up is that if you're vaccinated, if you're fully vaccinated with a booster, you're less likely to end up in hospital. And that is really part of what we want to preserve.
Right, absolutely. And in fact, that's kind of part of our next question. C said, as long as hospitalizations stay stable, case numbers shouldn't really matter, should they? But as you just said, it's likely if the case numbers go up that the hospitalization numbers will go up, right?
And they have been going up. That has been noted, that our hospitalizations are going up. We also have to remember that this time of year, the end of December, it's always challenging in a hospital. We know that we have other viruses. I just got a result for a patient, a child who had RSV, respiratory syncytial virus. Right. That can make children very sick and end up in hospital. We know that influenza spreads at this time. There's also enterovirus, rhinovirus. So it's not just COVID that's also in our hospitals. We want to make sure that we have a bed for the person who has a heart attack so that they can get the treatment that they need, for example.
Right, exactly, right. And that's, I mean, we've been talking about that from day one, is that we have to prevent the hospital system from being overwhelmed. That's the biggest thing, because we just don't have the room for everybody who might get severely ill. Okay, we've got a few live questions coming in from YouTube and our website. Let's take the website question from George. For Christmas family gatherings, we intend to have everyone do a rapid antigen test. How accurate is this test, and are all rapid tests made equal?
Okay, so I think what we need to realize is you can test negative on a rapid antigen test and still be contagious with the virus, including this virus. I mean, the rapid antigen test is a good measure, and you know, if it's positive, you need to get the confirmatory PCR, but it may be very indicative of infection. If it's negative, it's really hard to tell. Maybe you're early on in your contagious stage. So we cannot just rely on rapid antigen tests to ensure that we have a safe gathering. In fact, there is this in Oslo in Europe, a Christmas party where everyone had to be tested 3 days before the event. Everyone was fully vaccinated, and still the Omicron variant was there, and it spread to a lot of people. So we have to recognize that. I would say keep your gatherings very tight, your social circle very tight. If you can meet outdoors, we know that is better. If you can meet with people, make sure they're all fully vaccinated. If someone is vulnerable, if they are a senior, if they have a weakened immune system, maybe they attend virtually to give them that extra protection. And again, remember, the most risky time is when we take our mask off and lose that physical distance, especially indoors. Right. And so that is also a really big consideration.
Right, absolutely. And Doctor, last week when we talked about these rapid tests, you mentioned that, you know, they're more accurate if you're doing it, say, for your work, like every, you know, couple of days. Can you go a little bit more into that regarding sort of how that boosts the accuracy of those tests?
That's right. So when they're more accurate when they're done sequentially as part of a screening program. So you have a 2-day, twice a week screening program. And when you use it in that way, it boosts the accuracy of the test. Really, if it didn't catch you this time, 3 days later, it might catch you that time type of idea. Actually, all children at schools will be coming home with rapid antigen kits and will be given instructions to test twice a week, Monday and Thursday, for example, during the holidays, to again have that more regular cycle of testing with the rapid test, because we know that improves its accuracy as well.
Right. Essentially, it's a numbers game. The more you take it, the more likely it is to catch something, if at all. Right. Okay. Okay. And then let's take a question from our website. Anna asks, just had my first dose of Pfizer and was told I have to wait 8 weeks for the second dose. People have had second doses at 3 weeks. Which one is correct?
Okay, good question. So good job getting your first dose. I do really want to congratulate you on that. Now, the recommended interval for the first and second dose is 8 weeks, and we are certainly really recommending that for children who are starting to get the vaccine. That is the recommended interval, but you could certainly always be eligible to get the second dose 3 to 4 weeks after the first dose, if that is something that you wanted to get that better protection sooner.
Okay, but you said the recommended dose is 8 weeks because it gives you that good immune response, right?
That's right. And I think for everyone, they have to balance their current circumstance, right? If they're in a higher risk situation for getting COVID, they may want to get the vaccine in a shorter interval. It is certainly up to them to decide that.
Okay, okay. And then we've got a question from YouTube. Toucan asks, can I get a rapid test for free in Toronto, or do you have to pay for them at the pharmacy?
So right now, there are a lot of rapid tests that are available in certain circumstances. Like I just said, every child will be coming home with a kit. There are supposed to be testing blips that will occur over the holidays at malls and certain places. So that's another place where there might be accessibility for a free rapid test. But beyond that, there's no way that anyone can just go somewhere and say, I want a rapid test that I'm aware of.
Right, right. Because I know in pharmacies, I think it's about $40 or $50 and you can get a rapid test, but they're certainly not free. Okay, let's go to our website here. Another question coming in. This person's alias is Anani. Anani asks, why are they not reinstating mandatory masks in gyms at this point?
So I think, as we're learning more about the Omicron variant, there may be more and more recommendations that will be coming in place in terms of how we can prevent the spread. So I think we all have to keep a close eye on the news every day for the next little bit. Yeah,
absolutely, absolutely. And let's go to Wings' question. Wings is our regular contributor. Good to have a question from them for our last session. With the highly contagious Omicron variant, should we switch to N95 masks? Will this action slow the spread?
So I think this is also a good question. I think what I would say is not everyone has access to an N95 mask. And we know with N95 masks, if you're not fit tested, what is the additional level of protection? So I would say to everyone right now, make sure you have a well-fitted, preferably 3-layer cloth mask that fits you well, or a medical mask that is well fitted. I think being well fitted is a really important point here. The mask that you wear makes a difference. Masks, we know, make a difference, but so does keeping a physical distance, staying home when we're sick. It's not, the N95 mask is not going to be the only thing that's going to get us out of this Omicron variant wave.
Right, and actually, if you want to know more about that, we have an article from my colleague Nick Westall on citynews.ca regarding the use of N95s, during this Omicron wave. So check that out, please, as well. We'll go back to our live questions here from YouTube. How does Omicron differ from the normal cold? Both unvaccinated and vaccinated people are getting it and spreading Omicron. So how does it make sense to use the vaccine passport or enforce the vaccine passport?
So I think by symptoms, you can't always tell the difference between an Omicron COVID infection compared to a cold. I mean, we've said that before, which is why you really need to be tested. But it's also why everyone needs to be very careful about their symptoms. And if they have any symptoms, they need to stay home and arrange to get tested. They should not be out, even with their proof of vaccination at a restaurant. It's the symptoms. A lot of people with the Omicron variant are getting symptoms. They may be milder symptoms, but they are getting symptoms like a runny nose, a headache, not feeling well, feeling unwell. And so if you have any of those symptoms that are new, stay home and get tested.
Right. And then the second part of the question is regarding the vaccine passports, which I know is a provincial thing, but in case you'd like to weigh in, Doctor, if both unvaccinated and vaccinated people are getting it and spreading it, specifically Omicron, how does it make sense to use those vaccine passports then? Because you can't really tell if you're safe if you're vaccinated or not.
Yes, so you cannot just rely on vaccination for this variant, and that's why I'm saying wear that mask, keep that distance, stay home, be very careful about what you do even if you are vaccinated. But there is no question that if you are unvaccinated, your risk of getting this variant is higher. Your risk of getting more seriously ill from this variant is higher.
Right, right. Okay, so let's move on to our next question here. If Omicron is more transmissible but leads to a less severe case, do we need to take further measures, or are our current health measures enough?
So I think this is something that we're watching very closely. I think because it spreads more easily, I'm not sure that it's much less severe, but it's people have some immunity, right? So, but the thing is, if it's so much more contagious and so many people get sick, even if it's 1% who get very sick, if you now have 1,000 people instead of 100 people, that's that many more people who will require a hospital care, and that's really what we have to keep a very close eye on.
Right. So are we looking at then more measures that are going to come back because we rolled back so many of them over the past few months? Are we looking at more measures that could come back in terms of restrictions?
I mean, I can't speak on behalf of our government, so I think we're going to have to wait to see. I know that there's a press conference later on today.
Yes.
Things may move on a daily basis. I think we all have to keep a very close eye. We've already seen some changes. So if, for example, you are a close contact, you've had contact with someone who had Omicron, maybe you live with someone who had the variant and you're fully vaccinated, now you have to stay home. You have to isolate. You cannot continue to go and attend work or school. That has been, for example, a change that has already been made.
Yeah, absolutely. Another live question coming in here from YouTube. Ruby says, how much more susceptible are you to Omicron if you have underlying conditions? I reached out to my university along with friends who also struggle with many types of chronic illness, and we were denied exemptions for in-person attendance. Meanwhile, many students got an exemption from the vaccine and will be able to be in class with students who are susceptible to the virus.
Okay, so I don't think there's any indication that because you have a chronic health condition that you're more susceptible. Like, I think we all have susceptibility depending upon, our vaccinations, our contact with someone who had COVID. But if you have a health condition, you might get more severely sick. And so what I would say to you is, if you have to go in, I mean, I can't comment on behalf of your school, but if you have to go in, have a good mask, wear your mask, don't take your mask off, and make sure you keep a physical distance from anyone when you are, if you're writing an exam or whatever it is.
Right.
If there's a window that can open the window, that kind of thing.
Right, absolutely. Okay, and then let's move on to some of our submitted questions here. We have 1 minute left, actually, so let's quickly squeeze this one in. What is the transmission rate of Omicron as compared to Delta?
It's more easily spread. One way that I've heard it explained is, if Delta gave one person the illness, Omicron will make 4 people sick, and so that's the reproductive number. Mm-hmm. It seems that the reproductive number for Omicron is 4 compared to 1 with Delta. And so if I make 4 people sick, each of those 4 people make 4 people sick, that's 16. That's how you get accelerated growth.
Right, absolutely. And then this last one, let's do this. Is Omicron taking over as the dominant strain already in Ontario compared to Delta?
Yes.
On that note, we've come to 1 o'clock. That is the last question for this year. Thank you, doctor, so much for your time and your patience, not just today, but for this entire year that we've been asking you all these questions and firing them at you. And thank you to everybody who participated every week, people tuning in and sending us their questions. We really appreciate it. And we'll continue this next year. We're going to try and come back early in January with the doctor, and we will continue with all your questions. Hopefully, fingers crossed, we'll be in a better position with Omicron. Thank you again, doctor, so much for being here with us.
Yeah, thanks everyone, and thanks for these just fantastic questions. Have a good holiday and early Happy New Year.
Right, and yeah, from me as well. Have a good holiday, early Happy New Year. Thank you, doctor. We'll see you soon.
Bye.
Bye-bye.